My name is Priscilla Zavala, and this is Truong reporting to you live from HOSA News. Today we'll be discussing the national epidemic that is taking over the human race.
This is an emergency, claiming 130 lives each day and causing over 105,000 emergency room visits each year. This means 130 families will never get to see their loved ones again.
This growing epidemic goes by the name of opioids. Opioids are becoming widespread due to their capability of fully controlling their host.
We have a recent case of a 29-year-old male in West Virginia who overdosed on fentanyl, which is the most common drug involved in overdose deaths since it is cheaper than heroin. This is what the lethal dose of fentanyl looks like next to a penny. This synthetic drug is 50 times more potent than heroin and 100 times more potent than morphine. In 2010, 14.3% of opioid-related deaths involved fentanyl. In 2017, it increased to a staggering 58.9%.
He passed away early this morning in the hospital. His wife and children were devastated about this sudden news. They stated they could have gone home sooner if they had known about the signs and symptoms of an opioid overdose.
Individuals under the influence of opioids will present these symptoms. Their body temperature is cold and their skin is clammy. The victim is unresponsive. Their breathing has slowed down or become absent. Their skin and nails have a blue discoloration to them. Their eyes will become dilated. And they will become dizzy and disoriented.
If you can identify any of these symptoms in a person, immediately call 911. And if your loved one is suffering with opioid addiction and dependence disorder, please contact a drug addiction hotline. It could save someone's life.
See, you'd be dead if you abuse opioids.
Stay safe and look out for your loved ones.
This is a map showing the concentration of opioid-related deaths throughout the United States. As you can see, the most deaths occur in West Virginia at about 49.5 deaths per 100,000 people each year, and it's increasing, with Rhode Island trailing right behind it at 30 deaths per 100,000 people each year.
West Virginia is consistently one of the weakest performing states in the U.S. There is a strong correlation between drug abuse and overdoses since they have less access to things like health care, education, and social support.
In order to decrease the abuse, we need alternatives. 80% of people who abuse heroin first misuse prescription drugs. Some alternatives for prescription opioids are acupuncture, kratom, and cannabidiol, also known as CBD.
CBD is known to help with chronic pain, anxiety, it reduces cravings for other drugs, and it does not give you the sensation of feeling high. Unfortunately, there hasn't been much research on its adverse effects.
Acupuncture has been recognized as a treatment for chronic pain. It works by putting needles through specific points in the body to stimulate the nerve, which then sends signals to the brain to release hormones, which then combat pain.
Kratom is a safe medicinal plant that is used to treat chronic pain and opiate withdrawal. According to WebMD, 806 users rated its effectiveness 4.8 out of 5 stars. The FDA still hasn't approved of kratom due to their belief that it has dangerous effects, even though 5 million Americans safely use kratom and there have been no reported deaths linked to it.
The American Kratom Association is trying to get kratom approved by the FDA, but they're getting ignored. 1,175 doctors, vets, scientists, and law officers told the Drug Enforcement Administration that they don't want a kratom ban. Like CBD, which was once seen as dangerous, kratom needs to be legalized.
If you do happen to become addicted and it is too late to consider the alternatives, there are treatments such as buprenorphine. Buprenorphine is a partial agonist drug, which means it bonds with the opioid receptors in our brain, but only gives partial opioid effect. This drug needs to be prescribed by a doctor because it is addictive, and for it to work most effectively, the drug dosage needs to be monitored.
Suboxone is another treatment that prevents withdrawal symptoms associated with addiction. It contains buprenorphine and naloxone. Naloxone treats drug overdoses in emergency situations, allowing the victim to breathe normally by reversing the effects of the opioid, and it's administered as a nasal spray.
People who stop or reduce their intake of opioids will experience withdrawal symptoms from mild to severe. This is due to how the systems in our body react to the changes that because they've become dependent on the drug. This is an opiate withdrawal timeline. First, we start at the beginning, taking your last dose. 72 hours later, you will experience chills, fever, nausea, insomnia, and diarrhea. This is where your physical symptoms are at its peak.
At 1 week, your physical symptoms begin to decrease. You'll feel tired, sweaty, anxious, nauseous. And at 2 weeks, you'll develop psychological symptoms such as depression, anxiety, and restlessness. After 1 month sober, you'll have depression and cravings. These symptoms will last for weeks or even months. When withdrawing from opioids, you must seek help from your medical provider.
In order to evoke change, we need to educate the public about opioids. Having public speakers attend schools in areas with high drug abuse to educate them about the negative consequences and signs and symptoms of opioids will leave an impact.
From our experiences throughout middle school, we've listened to many public speakers talk about not doing drugs, and personally it's benefited us. Now that we're in high school, we haven't had the same guidance that we did in middle school.
High school is where most change occurs and people are easily influenced. So why is it that we don't have public speakers speak to us? Imagine how many future lives we can save if we had people spread the message.
Some of us might think that it's a waste of time and we already know not to abuse drugs. But you cannot do all the good that the world needs, but the world needs all the good that you can do. Thank you.